Good morning to all. My class 2,1. Today we are going to study Unit 11. Unit Before this class, you studied Unit 10, which talking about the primary health centers. The concept of primary health center we studied. Today we are going to study the strategies in primary health centers. It is a follow-up of 10, Unit 10, though it is considered a separate unit, but it is going to talk about the same thing in relation to primary health care. So today we are going to discuss different strategies in primary health care, which emphasized under Almata declarations. There are four strategies were emphasized under Almata declarations in terms of primary health care. First one is community participation. Second one, self-reliance. Third one, social mobilization. Then intersectoral collaboration. These are all the four primary healthcare strategies were emphasized under Almata declarations. This is the one we are going to study one by one. For this class, I am setting 3 learning objectives. End of this class, you are supposed to understand the importance of strategies in primary health care. How the strategies are very important in terms of ensuring primary health care. That is the area you need to understand. Then you also understand the common strategies employed in primary health care, namely community participation, self-reliance, social mobilization, and intersectoral collaboration. Then, and also you need to discuss yourself along with your colleagues these strategies, how it can be applicable in terms of Gambia as a country. So you need to understand the importance and the different strategies and discuss the strategies with local context. These are all the things I expected from you too. So before going to discuss these things, these strategies were centered around or set based on the principles of primary health care. So these principles were centered or setting the tone for the strategies. So primary healthcare principles, it's mainly health for all. The health for all, the concept of health for all is justified on Almata Declaration as a fundamental human rights on the basis of equity and our economic and social development. So health for all is justified under Almata declarations and recognize Almata declaration recognized health for all as a fundamental human rights on the basis of equity and economic and social development. This emphasis is very prominent in Almata declaration because before this Almata declarations, health is not recognized as a human rights. After Almata declaration only, the health recognized as a fundamental human rights. So there are four principles commonly, four principles are strategies commonly applied in primary health care. One is equity in distribution. Second one, appropriate technology. Fourth one, multi-sectoral approach. Fifth one, community participations. These principles and strategies are interlinked. So we are going to because my previous slide I told community participations, self-reliance, social mobilization, and intersectoral collaboration. The same strategies were streamlined based on PHC principles: equity, appropriate technology, multi-sectoral approach, and community participations. So we are going to see the principles of primary healthcare one by one. The first principles, it is equitable distributions. Equitable distributions. This is the first and foremost principles of primary healthcare strategy. The key principles in primary healthcare strategy is equity and equitable distribution of health services. I hope you understand the term equity or equitable distributions. Each and everyone, they should get equal treatment. There is no difference. Whether it is in terms of gender or in terms of money or wealth, you are not going to be distinguish anyone. You are going to treat all the patients equally. are your distributions. The healthcare distribution is supposed to be equity and equitable manner. But again, I am emphasizing here, the health services must be shared equally by all people, irrespective of their ability to pay. Whether the person have ability to pay or not, as a state, they need to set a service equal to everyone, without or irrespective of their ability to pay. Whether I'm a poor, I'm not getting first class treatment. If I'm a wealthy person, I can able to get healthy, uh, healthy treatment or affordable. Here there is no affordable term. It's supposed to be. It's a human rights. All the person without any difference. All people, irrespective of their ability to pay. Again, I'm continuing with equitable distributions because this primary health care aims to readdress this imbalance, because the imbalance is already there. Before Almata declarations, imbalance is very high. So the primary health care aims to readdress this imbalance by shifting the center of gravity of healthcare system from cities to rural area. This is the emphasis given under primary health care, because mostly the healthcare facilities were located in cities, but the urban centers, but the rural areas were lacking with healthcare facilities. So the primary healthcare aims to readdress this imbalance by shifting the center of gravity of the healthcare system from cities, where 3/4 of health budget is spent. When you are calculating your before 1986 health budget, most of the health budgets were 3/4 of the health budgets were spent in in urban areas or the cities, but rural areas, but where 3/4 of total population were living in rural areas, but the health facilities they are receiving, it's a 1/4 of their total health budget. This imbalance supposed to be readdressed. That is why the equitable principles were equitable distribution is emphasized in Almata declarations. It applicable to almost all the countries. It is not exactly for Zambia. It applicable to almost all the countries. Even still now, when you are counting the teaching hospital, number of teaching hospital located in Lusaka, when comparing with the faraway provinces, this bring the services as near people's home as possible. So one of the major aim, the equitable distribution emphasize bring the primary healthcare services as near as possible to people's home. So equity means, in terms of health, in terms of primary health care, service to all. Equity means there is no difference. Service supposed to given to all the people. So more service to needy and vulnerable people. There is a postulate, service supposed to be given all the people. The second one, more service to needy and vulnerable populations. So those who are in need, those who are vulnerable, they need to get more services than others. That's the second important things in terms of equity. For example, while continuing to provide essential healthcare for all the populations, irrespective of socio-economic and cultural preferences, it extended, the care is supposed to be extended to provide high-risk populations. So though it is talking about equity, but within the equity, you need to extend your services to high-risk populations. So irrespective of socio-economic cultural differences, you need to provide the services to everyone, but you can also extend your services to provide to the high-risk groups in the community, either within the health centers or by referral from the health centers to higher level of care or hospitals. So there is equity, it talking about equal services to everyone without any differences in terms of socio-economic cultural preferences. It also emphasizes to extend the services to high-risk population. For ensuring equity, every primary health centers or every country, every community, they supposed to do following things. For ensuring equity, the population to be served must be known. So your health post or your primary health center is supposed to know how many people they are going to serve. So they need to do a survey to know how many populations are there depending the primary health centers. So the population needs to be served, must be known. Then they need to know the vulnerable groups are to be identified and reached. So they need to know the total number of populations. Within the total number of populations, they need to know vulnerable groups to be identified and reached. So equity in distribution is continuing. For ensuring equity, the health services, um, not necessarily health centers, have to be dispersed into the health services have to be dispersed into the fourthmost remote rural areas. The health services supposed to be extended remote rural areas. Then the deepest part of underserved urban populations. It's not only rural areas. The service is supposed to deepest part of underserved urban populations. For example, settlements, urban slums, or you can say the compounds. The deepest part of the underserved population needs to be captured or needs to be extended the services within the urban population also. The urban populations, you have lot of compounds. This compound needs to be given proper health facilities. Then the failures to reach the needy and majority is usually due to limited geographical access. You have a one primary health centers. It needs to cover a lot of area. Means you are going to left out needy population and majority usually due to your limited geographical access. This needs to be addressed. And also to ensure equity, accessibility has to be improved by increasing the number of health facilities. If the health facility is serving a larger population, then it needs to be restricted with certain numbers. For example, primary health center, according to Almata declarations, a primary health center is supposed to serve 5,000 population. A health post supposed to be 500 populations. This needs to be commonly followed in any country. So the increasing the number of health facilities needs to address equity and accessibility in terms of improving the health services, and also to improve the transport conditions. Because your PHC is located in faraway places, then you need to establish a proper transport facilities for your primary health center. Most of the primary health centers were located outside the hamlets. So you need to establish a proper transportation conditions. Then the primary health centers also need to organize outreach services, thus substituting one when the other is not available. Then primary healthcare aims to correct the imbalance in terms of accessibility, then bring health services as near to people's home as possible. Then to achieve this, primary healthcare is supported by higher level of healthcare to which patients can be referred for extended care. So in terms of availability, we already discussed so many things. Now I'm emphasizing here, correct the imbalance in terms of accessibility. So you try to bring your health services near to people's home. To achieve this, primary health center healthcare is supported by higher level of healthcare to which patients can be referred to extended services. Primary health centers not possible to keep all the services because they can able to do only preventable services. Preventive aspects only they can able to do, but the referral services needs to be taken care by the district hospitals. So the referral services needs to be extended to all the needy populations. Now we are going to talking about community participation. The principle number 2, community participations, or you can say the strategy number 2, community participations. To ensuring community participations, the Almata declaration is talking about involvement of individuals, families, and communities in promotion of their own health and welfare. It is not only talking about health, it also talking about the welfare, because the health is a holistic concept. It is not just talking about physical health. It is talking about mental, socio-economic, and mental health of the patients. So ensuring community participations, it's supposed to be involvement of individuals, families, and communities in promotion of their own health and welfare. For ensuring community participations, there must be a continuing effort to secure a meaningful involvement of the community in planning, a continuous effort to secure a meaningful involvement of the community in planning, implementation, maintenance of health services, evaluation of health services, then maximum reliance on local resources such as manpower, money, material. So this for ensuring a meaningful or ensuring the meaningful community participations, we need to involve the local community in our primary healthcare programs through planning process, implementation, maintenance of health services, evaluation of health services. So for this process, you need to tap in your local maximum reliance on local resources. You need to appoint locally trained healthcare professionals. So the manpower supposed to come from the local resources. Then money also supposed to come from local resources and materials. So this is very important. These are all the way you can able to ensure the local participation. So the community participations is emphasized because one of the principles of primary healthcare, it's universal coverage. So the universal coverage by primary healthcare cannot be achieved without involvement of the local community. So if you want to achieve the goal of universal coverage by primary healthcare, cannot be achieved without the involvement of local community. In short, primary healthcare must be built on the principles of community. Participation or involvement of community is must. Then the principle number 3, intersectoral coordination. There is an increased realization of the fact that the components of primary healthcare cannot be provided by health sector alone, because the concept of health is also talking about socio-economic, political aspects. So there is no increased realization of the fact that the components of primary healthcare cannot be provided by the health sector alone. So it should involve other sectors as well. So the intersectoral coordination, it emphasized under Alma-Ata declarations. Primary healthcare involves, in addition to the health sector, all related sectors, apart from health sector, all related sectors and aspects of national and community development, in particular agriculture, animal husbandry, food, industry, education, housing, public work, and communication, and other sector. These are all the sector you need to invite or include in your health sector planning. So the Alma-Ata declaration, it emphasizes primary healthcare. It involves, in addition to the health sector, all the related sectors and the aspects of national and community development, in particularly agriculture, animal husbandry, food, industry, education, housing, public work, communication, and other sectors. They must be included in primary healthcare. They must be coordinated. Intersectoral coordination should be among the sections. Appropriate technology. Principle number 4 or strategy number 4, appropriate technology. Appropriate technology means, definition of appropriate technology says, technology that is scientifically sound, adaptable to local needs, acceptable to those who apply it, those for whom it is used, and that can be maintained by people themselves in keeping with the principles of self-reliance with the resources the community and country can afford. So when you are talking about affordable technology, the technology that is scientifically sound, adapted to local needs, and acceptable to those who apply it, those for whom it is used, that can be maintained by local themselves in keeping with the principles of self-reliance with the resources of community and country can afford. Whatever technology you are bringing under primary healthcare, it's supposed to be scientifically sound. It should be adaptable to local needs, acceptable to those who are going to apply, those who are going to benefit, for those for whom it is going to be used, then it can be maintained by the local population, local people themselves, in keeping with the principles of self-reliance within the resources of community and country can be affordable. The health technologies are required not only for diagnostic maneuvers, therapeutic maneuvers, but also for disease prevention, disease control, health promotions. It is not only for diagnosis and therapeutic technologies, it also includes disease prevention, disease control, and health promotion. Though it is community perceived that the person who is going to apply it is a trained health professional in primary healthcare practice, there are instances where technology may have to be applied by individuals, by themselves, family, community. For example, use of toothbrush, eyeglasses, domestic water filter, domestic pest control, etc. can be used by individuals, families, and communities. So these individuals, families, community need to be educated, and also the technology needs to be affordable to them, and also this technology needs to be scientifically proven. So this technology should be applicable for self-use also. So the simplicity of the technology is also always desirable. For example, ORS in diarrhea disease control, because ORS it's supposed to be made available by the individual, by the family, and by the community itself. So how to prepare ORS? It's supposed to be educated to the community. Then breastfeeding, in facing it. What is the interval for breastfeeding? How long it's supposed to be done? It needs to be done by the individuals and community themselves. Then weighing for growth monitoring. You need to teach your pregnant women and the postnatal women. They're supposed to learn weighing for growth monitoring. This needs to be by themselves. Under primary healthcare in Zambia, according to the health promotion, the healthcare strategies of 2016 to 2021, the following things were mentioned under the national plan, the national health plans. The goal for primary healthcare in Zambia to empower communities to taking responsibility for improving their own health status through community health interventions in line with the principles of primary healthcare by 2021. This is exactly the goal set 2015 by the Ministry of Health through health promotion, health education strategies 2015 to 2021. Objective for this health promotion strategies in terms of promoting primary health care to formalize community health structures in line with the decentralization policies. So whatever health post and primary health centers, they need to be formalized to formalize community health structures in line with the decentralization policies. That is how the health post, health centers, district hospitals, then teaching hospital. This structures formalized within the primary healthcare strategies 2021. So for this objectives, it is going to be met using the following strategies. The facilities, the inclusion of community health structures in existing and emerging regulatory framework, such as Public Health Act and National Health Service Act. So facilities, the inclusion of community health services should be done under Public Health Act and National Health Services. Whatever facilities established by in community health services should be incorporated within Public Health Act and National Health Services. Then develop and implement community health strategy implementation framework as a state. Then establish national and district and community support structures. You have at community level, you have a community clubs, community health clubs. You have community health clubs which operate based on the neighborhoods. Then it also facilitates technical skills development of community health workers. We have a lot of health schools to train community health workers. It also encourage, strengthen the multi-sectoral collaborations, community linkage, and coordination in line with the decentralization policies to address social determinants of health and within the health in all policy frameworks. It also revives the use of national health coordinations, guidelines in community health schemes for community-based volunteers. Then it also it encouraged to strengthen the community participation in planning, coordination, implementation, and monitoring and evaluation at facilities and community levels. It also encouraged to create and enable the environment for participation of traditional, civic, political, and faith-based organizations, media, academic, in executing all inclusive, gender, and sensitive community health systems. It also have three other strategies which include to strengthen health promotion and health educations at community level. This health promotion and educations at community level, the following strategies were given under 2021 health promotion healthcare strategies. Strengthening the integration of health promotion and disease prevention at community level, then strengthening comprehensive e-learning institutions, school health and nutrition, and comprehensive sexual health education programs, which supported under UNESCO. Promote intersectoral collaborations, which include private-public collaboration at community level. Certain health posts were managed by NGOs and private sectors. Then enhance demand creation for center-sensitive community health services, and also scaling up recruitment and retention of community-based volunteers. Scale up standardized capacity building for health promotions at education at district facilities and community level. Then another objective number 4, it encouraged to improve the capacity of districts, hospitals, and health centers to deliver healthcare services at community level. This is going to be implemented through the strategies of revising the primary healthcare packages to focus on health promotions, disease prevention, basic healthcare, multi-sectoral collaborations for community health. It also develop a framework for delineation of the role and functions, as well as standard operation procedure to support healthcare and technical skills at each level. It also encouraged to revitalize the referral and feedback system between health facilities and community. It also strengthened the primary healthcare facilities with appropriate staff, equipment, supplies, and essential medicines and commodities. So finally, to mobilize adequate financial and other resources to strengthen the community health. This is also strategy number 4. For the strategies, the following, for this objective, the following strategies were encouraged: to ensure equitable resource allocations considering demographic, geography, and disease burden and gender is used to allocate the resources. Then develop mechanism for ensuring that 10% of district healthcare organization is reserved for community health services. Then introduce community financing schemes, strengthening community-based healthcare services to be linked to all the levels of health delivery systems. Develop enhanced skills for utilized community-based HMIS data for decision making. So it also going this line. You can, when you go through your notes, you can able to find what are all the objectives were framed under healthcare, primary healthcare strategies, how it is going to be addressed using different strategies. You can able, when you are going through the notes, you can able to find it. I'm not talking about the implementation. I'm just talking about the objective of the National Health Plan of Zambia, how it is going to be addressed through the following strategies. So I hope this unit you learned the importance of the strategies in primary healthcare, and also you can able to discuss different strategies. Community participation, self-reliance, social mobilization, and intersectoral collaborations in primary healthcare. Now you can able to discuss primary healthcare strategies in Zambia as well. This is how I'm ending up with unit number 11. Thank you. Have a nice day.